Hi, my name is Jason Heid. I'm a senior editor with Texas Monthly Magazine, and I'm your moderator for this panel on recovering from the economic impacts of the pandemic. These impacts we've seen on poverty and unemployment and workplace productivity. And we're going to try to discuss how we can build forward from this in a better way that addresses some of the issues of inequality that have been laid bare and exacerbated and exposed by the impact of this pandemic. We have a global group of panelists for this session. And I very quickly want to get them talking and have me stop talking because it's their insights that I'm interested in hearing today. First up, we have Carl Manlan, who's in Lomé, Togo in West Africa. He's the Chief Operating Officer of the Ecobank Foundation, where he's responsible for Ecobank's social impact engagement. Previously, he led a public-private initiative to support an African response to Ebola in West Africa. We also have Kelly Fisher, who's in Queens in New York City. She's the head of corporate sustainability for HSBC Bank USA, where she shaped its corporate philanthropy strategy, increased volunteerism, and is driving its new net zero strategy. In Dallas, we have Andrew Keller, who, in addition to being a licensed psychologist, is president and CEO of the Meadows Mental Health Policy Institute. That's a policy and research nonprofit that aims to improve mental health care in Texas and the nation. Previously, he was managing partner at a national behavioral health management consulting firm. Lastly, we have Trey Watkins, who's outside New York City. He's an executive vice president of global health and corporate responsibility at GCI Health, where he advises clients in a variety of areas to address the critical global health challenges in a shifting landscape. So all of that is way more impressive than any of the items I could tell you about my own resume, but I'm sitting here in Austin, the capital of the great nation of Texas, and we're very excited to be with you. So let's get right to the discussion. First off, as I was mentioning, I think the story of this pandemic, especially when it comes to the economic impacts, is that it has exposed elements of our society and exacerbated trends that were already in the works in many ways. It's not so much, to me, a story so much of inventing problems as just making problems impossible for us to ignore and intensifying those issues. So each of you, though, has your own unique story to tell about your work and how it's focused on aiding in these global healthcare efforts and health efforts. So first off, I'd just like to have you share, each of you who share with us, how you think we can in the future be more prepared than we were for this challenge for future global scale challenges. So why don't we start with Kelly? Could you start off there, and then we'll just go around the room. Thanks.
Thank you, Jason. And it's funny, when I was contacted about this panel, my gut reaction was to say, well, I don't work in health. And then I realized, wait a second, I'm focused on climate change and employability, particularly putting people of color and women and others who need it back to work. And I realized I actually am focused in health. I just don't describe it that way. And what I would say that, and I love what you said about we didn't, have new problems arise, we just uncovered them, is spot on. And what I like to say now is this pandemic has been the dress rehearsal for the climate change performance that we are not prepared to give. Climate change and equity are the two most important things that I face and that we should all be facing on a daily basis. I think that if we don't build back with those two things in mind, we fail. And I think that if we don't see that they're completely interdependent on each other, we also fail. I think all of humanity we found out was actually calling for equity, and what we discovered is we didn't realize, or we didn't credit how vital it was to our economic prosperity, our health, and the equality that we need, right? So a couple things I'll point out, because price of admission should include a couple facts, and I don't want to drown you guys, but people of color are more likely to die of environmental causes, and more than half of the people who live close to hazardous waste are people of color. So if that doesn't show you how climate change and the fight for equity are interconnected, I don't know what does. And right now, nearly 40% of our population are people of color, and that's expected to grow to 50% by 2044. So we have to acknowledge that these two things are closely connected, and we have to build back with those two key things in mind. And there are systematic changes that need to be made. I understand I'm speaking to scientists here today, and you have my deepest respect, those of you who are in science, or in a research-based capacity. But if I'm also speaking to people who have public or private funds, that's where I'm coming from. So I want you to hear me when I say we have to make a change. The last time a study was done about US foundations and our giving, it showed that only 7% of the giving of foundations in the US were set aside to support ethnic and racial minorities. Inappropriate, wrong, that has to be fixed. And I'll tell you, an even smaller fraction were for women and girls and people with disabilities and LGBTQ. And in addition, those funds were awarded by grant makers governed by white leaders. 92% of foundation CEOs, 83% of executive staff are white. So we need to change who we're reaching. We need to change the ways that we're reaching out. And we also need to change who's in the room helping to make the decisions. And so I'll end there and just say that that's what is on my mind every day, is climate change, equity, and how those two are combined. And thank you for inviting me here today, because now I can say, wait a second, I am focused on health.
Absolutely. Trey, why don't you take it up from there?
Yeah, thanks, Jason. Sorry, I was just finding my unmute button. Thanks. So you think a year into this, we'd all know where the unmute button is, but I still find myself scrambling to find it. Thanks for the question. Thanks for having me. I'm really kind of thrilled to be joining the discussion. And I couldn't agree more with what Kelly has said. My background is squarely at the intersection of international health and development. So this is what we have been, quote unquote, preparing for. Clearly, we were not prepared, and so lots to learn from that perspective. But I think, Kelly, as you're saying, as you think about moving forward and thinking about climate and equity, my God, so important. And I think we've seen it more than anything now. And I'm, really thrilled when we think about how we are already starting to look to the future and build back better, stronger, fairer. As we look to the new U.S. administration really placing climate at the center of all of our policies and investments, including those international and at the center of our aid practices. So I think really promising things there that I would be just remiss to not point out. I think, for me, a couple of things that I think, when I think about, your question, Jason, and how do we be more prepared, right? Well, first of all, we've got to invest. I think we saw as we were moving into this, we had been investing and scaling up those investments in pandemic preparedness and global health security in the midst of political shifts. We saw those really gutted, and we saw a decrease in funding across the board from a global health perspective. And we're not just talking about the U.S. when we're saying this, though clearly a player. And we see the result, right? At the end of the day, we were not prepared. And so I think we've got to invest back in those surveillance systems. We've got to invest in systems that are prioritizing health, not just medicine and illness, but we've got to really look at comprehensive surround sound systems that focus on health more generally and are able to meet the shifting and evolving demands of their communities while also not buckling under the pressures of global pandemics, epidemics, et cetera. I think we've got to keep in mind the indisputable, in my opinion, value of multilateralism and international coordination and partnership. We have seen multilateralism questioned in the past year. And And is there room to question our structures and our systems? Absolutely. Is multilateralism needed? Absolutely. Right? So I think we've got to think about how we are restructuring ourselves and rethinking about how we are working together in a way that really is underpinned by solidarity, by accountability, and by God, by equity, right? And so I think part of that is I come to this very much from a global health perspective, but I think whether we're looking at health in Detroit or Nairobi, we've got to think about decolonizing our systems and our approaches so that communities of color are placed in the driving seat, communities in need, communities who carry the highest burden of these diseases are not only viewed moving forward as recipients, but really as true partners who are helping to curate and co-create the solutions that are needed. So those are a few things that are on top of my mind.
Great. Carl, what's your perspective on how we could have been better prepared for a global challenge like this?
So I think Trey and Kelly put some important points on the table. I'll just add maybe one, which is around social safety net. And a social safety net is very much linked to the question around employment and job creation. We shouldn't disconnect the two. And I think what the pandemic has allowed us to realize that you can't discuss economic opportunities and health on the other side. This is just one conversation, because the people that are going to be working, their health is at stake. And specifically on the social safety net, in countries like Togo, where I live, they put in place a system to allow informal workers to have access to a cash transfer. And this was done within 10 days and 10 nights, as the Minister of Digital Economy used to say, has been saying. And it was made possible because of prior investment, but the fact that digital is key to ensure that we can reach more people. And the social safety net was basically put in place at the time when it was most needed. And it was tested, and I think it has helped a lot of people. But where we need to make sure that we're better prepared is that we don't separate the conversation about climate change, around health, job creation as sort of silos. They're all connected. And I think this is critical as we think about building forward in a better way. And actually, Jason, I like that expression better than building back better.
Yeah. I mean, that's what makes this so difficult, right? All these things are interconnected. You can't really silo off and address one at a time. Yeah, Andrew, what's your perspective on how we could have been better prepared?
Well, I think all the things that have been talked about are critically important. One thing from our perspective here in the mental health world, it would have been better if before the pandemic we had understood that our mental health is actually part of our health. One of the things that annoys me most is when people talk about mental health versus physical health. And I'm like, I'm pretty sure my brain's in my body. I mean, I've never actually seen it, but it's just theory that I have robust confidence in. And, we were doing a terrible job with mental health and addiction before the pandemic. Deaths from suicide, overdose, comorbid health conditions like diabetes and hypertension, heart disease that mental illness makes worse, addiction makes even worse. We're at 20-year highs, the worst ever in America. And I think, and your point you made, Jason, about how, underlying things were revealed. That is true. Like if you look at about 1/3 of folks who have mental health exacerbation of their conditions who have COVID, about 2/3 of them had pre-existing mental illness. And about 1/3 is new. So it's kind of a mix of mental illness. And I think we all know that, right? I mean, if you lost a person, if you had someone that you cared about who was in a nursing home and you lost and you couldn't see them when they passed, I mean, that sort of complication. And, or just even stressors like Trey, what you were saying earlier, like, where's my mute button? I mean, we're all getting used to this new world. And so it's the little stressors, the big stressors, the parents who work with me who, had to run home schools while they were, at work, so all of that was there. And, and I do think a couple statistics are helpful. I mean, in the last year, deaths from overdose increased by 1/3 in the United States, like not 5%, not 20%, 1/3. Mental illness is the second leading driver of death from COVID behind age. So when we look at risk factors out there, mental illness, and it's a predisposing factor for almost all comorbid illnesses. It makes them worse. If you have a heart attack, you're 3 times more likely to die in the year after your heart attack if you survive the heart attack, if you have depression. And so, and it's worse, the inequities are worse. So, we do that before. Like if you were a Black American or Latino American, other person of color, you were more likely to have your first encounter with mental health services in a justice setting. All of us are likely, if we call 911 for a mental health condition, like when I called 911 because our son was coming early and my wife and I needed someone to help us, they sent an ambulance. But if you call 911 with a mental health concern, they're going to send police in almost every community in the United States. And so those were our pre-existing conditions. And then COVID's made that worse. Just in Texas, Latino Texans of working age died at 4 times the rate of other Texans because of COVID. Black children in the United States are 50% more likely to have lost a parent from COVID or a caregiver than other children. So this is like, these inequities are deep. They were exposed. But here's the thing. It's not rocket science. In a year, we dealt with, we're not done. And I think, outside the United States, in places where we got to get further on with the vaccinations, we've got a lot of challenges. So I don't want to pretend like we're done, but we've made some tremendous gains in the year. And it's just 3 things: detection, early treatment that works, not early treatment that doesn't work, and prevention. Like that's it. If we had just thought about that in a universal way with the same energy we put into COVID about mental illness and addiction, we wouldn't be in the place we are. So I think that's one of the hopeful things, is we can do this if we put the will to it.
Yeah. So let's get to the hope a little later. First, I want to talk a little bit more about some of these challenges revealed. Trey, I think you mentioned, this sort of, it's your field to understand this relationship between global health and economic development. But I'd love to hear more from you about what you think this past year pandemic has revealed to the more general public, people that aren't thinking about this all this time, about what is that relationship between global health and economic development, and why is it so important?
Yeah, I mean, at the end of the day, there's no way to unravel them in my mind, right? Health is wealth. Wealth is development, right? So it's at the very core, I think, health is of our collective well-being, societally and economically. And so there just is no way, frankly, to unravel those. If we're being frank, I think, it's clear that healthy societies yield healthy economies. And we saw this year, right, as our systems buckled under the pressures of COVID-19, as our societies really just were brought to our knees, our economies were nearly also brought to the knees, right? Almost to an entire halt, right? And so it's interesting. I think we've seen the economic impact of COVID-19 as we think about the delays of production, as we think about the number of people who are out of work and struggling here in our own nation, right? That a global health emergency, a crisis, caused that, right? That led to folks being unemployed, experiencing increasing risk of homelessness, of hunger. These numbers are rising even here in our own nation, where we don't always think about them as much as we should, frankly. And so, I think we have seen very clearly. So not only, I think, has it been a lesson in what public health is, now my parents and my friends kind of understand what I do, which is exciting because public health is at top of mind. But I think we see the intersections, right, of public health and economies and on societies and on, right? There is just so much that health is so central to. It is at the center of our most ambitious Sustainable Development Agenda, right? In 2015, world leaders adopted the Sustainable Development Goals. There are 17 goals. Health is one of those goals. It is related to all of them, right? And so we really cannot think about our collective development without thinking about our collective health. And I think this year taught us that what happens in Wuhan, right, impacts what happens in Lincoln, Nebraska. What happens in Lincoln, Nebraska impacts what happens in Wuhan, China, right? It's all global is local, local is global, right? And so we have to really be thinking about this in a much more interconnected and globalized way. I mean, even now, and I'm sure we'll get to this, but when we think about even reopening economies, Jason, it's shocking to me that we talk about reopening our economies when the vast majority, the backbone of those economies, cannot get access to a vaccine. So I think we've seen health impacting economies. Now we see on the flip side, we have the tools. How do we use them and disperse them in an equitable way so that we can actually get our economies back up and running in a more full way?
Yeah. Building off of that, Carl, I'm sort of interested, since you're the one outside the United States and you have that perspective, what's your view on this interrelationship between global health and economic development? So
Trey spoke about Wuhan. Let's go back to Nzerekore in Guinea, 2014, with Ebola outbreak. It was a coalition of 50 countries plus, led by the US. Billions of dollars that were pledged to make sure that it doesn't spread. But when we think about it, it was Guinea, Liberia, Sierra Leone. It's less than 1% of Africa's GDP. So it's actually quite strange that when we were dealing with less than 1% of Africa's GDP, we were able to collaborate, we were able to put resources on the table. Now that we're dealing with the whole economy, the whole world, and the whole GDP, we can't collaborate. Mm-hmm. It seems to have reverted to nationalism at a time when we could have used the expertise that we learned from the Ebola crisis and the leadership of the US in that particular matter, the leadership of the African Union in raising domestic resources from the private sector to send health workers from the continent, from the rest of the continent to West Africa. So the interconnection is real. It's just that this time around, it became evident for everybody. Mm-hmm. Back then, when it was in Ebola in West Africa, it seems to be far, with a few sort of travelers that made it to the US and other parts of the world. But if you think about SARS, it was no different. It started in Hong Kong and then traveled to Canada. It's just that we have sort of become accustomed to the idea that diseases are from far places like from the African continent, Southeast Asia, and so on. And then we realize actually, no, they are everywhere. Viruses are everywhere, and they can actually change and make our lives difficult. So I think from that perspective, with the billions of dollars that are spent in development aid every year to ensure that there is a better health system in place, the question then remains, can we do the same to ensure that people have access to better jobs? Because once they have access to better jobs, there are certain things that we will not have to ask them to do, like hand washing, because maybe they can afford better sanitation, or vaccinating their own children, for example. So I think the way we have thought about it, and I think also global health has probably made a bit of that mistake of having this parallel track and that parallel conversation that we need to raise money for health. Then when they come to the banks, for example, it is we need a check. And they don't think about the resources that a bank like HSBC or Ecobank will have in terms of helping to push forward those ideas. For example, we launched a malaria program last year, and it's the head of a commercial bank of a group that is actually leading that initiative. Why do we do this? Because we want to make sure that we have new faces in this conversation, that when bankers are engaging with ministers of finance, when they're engaging with Reserve Bank governors, these conversations around the impact of health is not just a number that they speak about, but they can also speak about their own experience of looking at the impact of malaria, for example, or the impact of COVID-19 at the moment, which is very clear to all bankers, given that we had to change the model of development that we have at the moment.
Andrew, I'm wondering about, from specifically a mental health point of view, do we have some sort of quantification of how mental health is affecting economic development, or can affect economic development?
Yeah, absolutely. So there's two big ways in which mental health impacts, economic factors. One is that it drives a lot of costs, a lot of physical health care costs, other physical health care costs beyond just the brain. 6 times higher is the rate of what your other bodily dysfunction is going to cost healthcare systems if you have a mental illness and a substance use disorder. If you have a serious mental illness, it's 5 times. If you have a regular old mental illness like an anxiety disorder like mine that's not being well treated, then it's 2 or 3 times higher. So that's one thing we need to understand. And that's why, we should have known. We should have been ready to say, hey, people with mental illness are going to be at higher risk of COVID. So we should have known that. But the second thing is so much of the economic impact comes through things like presenteeism and absenteeism. We know what absenteeism is. You're not at work. Presenteeism, you just show up, but you can't get anything done. Because it's not just your own mental health that affects that. It's like if your son is suffering from suicidal thinking and you're at work, you're not going to be thinking about work all that well. So just depression alone costs the U.S. economy about $250 billion a year, mostly driven by those 2 things. It's not the treatment of the mental illness. In fact, we looked really closely at what health costs were for mental illness versus other physical conditions. Among the top 10% of folks that account for 70% of healthcare costs, among that 10%, 57% of them have a mental illness. The spending on their mental illness for most of them was under $100 a year, but their overall healthcare costs were in the tens of thousands because we don't do a good job. We don't get there early. We wait 8 to 10 years till after symptoms emerge. And there's global lessons to be learned here. One of the big things we're doing here in North Texas, we have a lot of areas that don't have healthcare providers, mental health providers, and that's true in a lot of the United States. Not so much in New York, but it's true everywhere else. And the other thing is we have huge barriers for people of color, people in poverty, people with disabilities. So we're partnering with the global health program at Harvard Medical School to bring in a community health worker model that was developed in India, central India, and we're bringing it in. And it's a technology-enabled model where we enable these community health workers with digital tools that allow them to do things pretty much as good as a lot of therapists can do. They're not therapists, but they can do a lot of great stuff with these digital tools. Our big barrier for getting this scaled up in North Texas is we have to translate it from Hindi into English. But once we do, it's a fantastic curriculum, and it takes those same evidence-based tools. So I think that's why this global dialogue is so important. Innovations can come from all over, and certainly, we have a lot of, blessings in the United States, but we have people facing a lot of inequitable access, a lot of poverty and particularly lack of access to healthcare. There's healthcare deserts. And I think lessons can be learned to help us do a better job here in the United States as well.
Yeah, I mean, these challenges you're all highlighting are so pernicious, and yet at the same time, once we start talking about them, it's kind of like, oh, well, of course this was a problem. Of course we should have done that. Of course we knew this was coming. Of course this was something we should have addressed. It all seems so obvious after the fact when we're faced with a crisis like this. In response to that, Kelly, what are some of the innovations that have sort of impressed you over the last year in terms of how we've responded to the pandemic, whether that's something that you and HSBC have done or some other organization? What sort of innovations have you seen out there that sort of hint at where we could grow from this?
Yeah, absolutely. Well, I mean, Carl alluded to this. I think the reason I chose my career path and the reason I've stayed in it is the profound impact that financing can play in making a difference. And I do want people to leave here hopeful today. HSBC has a tremendous power. We're one of the biggest global banks, and we're in developed and developing nations. And we have a profound role to play with financing. And where I get excited and where I really love my job is the innovation the connection between philanthropic financing and then where business financing takes over. So things like, we're investing $100 million globally in climate change mitigation, pulling carbon from the atmosphere. That's philanthropic. But we're also committed to $1 trillion in sustainable finance and investments. Mm-hmm. So it's things like, well, we'll invest in renewable energy in developing nations that need them philanthropically. And then we'll give a loan, a sustainability linked loan or a green loan or a green bond or a social bond to a client who will then take it over, and it becomes profitable and part of their business to do things in a better way, in a more meaningful way. And I work at that intersection of both. So to me, I wouldn't want to work anywhere else than right there, right now, because that's so interesting to me. And I really do think there are a lot of reasons to be hopeful. I loved what Carl said, and he said it in such a lovely way, but I'm not going to be as nice. We need to stop being so nihilistic and so protectionist, and we need to see the impact that we all have, instead of shutting the doors of our nations collectively and saying we're just going to take responsibility for our own people and not even do that very well. We need to be interconnected, and we need to see these huge opportunities. And I'll go back to the two things that I talked about, because those are my areas, just the way, Andy focuses on the impacts that addressing mental health can have. The impacts that we can have by addressing climate change and inequity are huge. And that's why I'm excited about what the administration is doing right now. I mean, one of the biggest detriments to climate change is that politics have interfered. It's the greatest threat facing humanity. And we've allowed it to become a red state, blue state thing, and it is not, and it should not be. So one thing I wanted to call out here today is the fact that Biden's new climate policy, experts have estimated, yes, we might lose about 70,000 old coal jobs and natural gas jobs, but we have the chance to gain, just in the US, over 500,000 new, better paying jobs in renewable energy and other green jobs. So there's so many reasons to be optimistic right now. And there's so many reasons to focus on the way our administration and others like Carl and other nations are trying to build back more responsibly. And same thing for equity. And I spoke earlier about people of color, but I'm really inspired listening to Andy. We need to face what's happening to women. We're in the worst she-cession that we've ever seen globally and here in the US. And I like to joke that we haven't seen this many women out of the workforce since Melanie Griffith put on her sneakers and got on the Staten Island ferry. There are less women in the workforce than there were in 1989. And Andy's point is very valid. Moms are drinking. Moms are turning to wine because suddenly they are trying to do their jobs and watch their child, or they had to leave their job because they had to choose. And why did we have to choose? Because this is the only developed country that offers 0 paid maternity leave. So research shows that set the expectation from the start that we're the ones who, if the push comes to shove, we have to take care of our children. And so women need those wraparound services to go back to work. So what I love about every other one of the panelists have been saying, and I've been trying to stress, is everything can't be taken in isolation. So if we want women and everyone else to go back to work, it's not about putting these women training programs out there, take more of our time to spend 3 weeks training us on leaning in. No, just get us a babysitter. Just get us childcare, right? Like, stop putting it on us and saying like, well, have you really talked about, leaning in and being more of a leader? We know how to be leaders. In fact, we're being 2 leaders at once if we're being a mother, actually 3, a teacher, and then I'm a senior vice president at work. So I really, there's so much reason to be optimistic. And I know, Jason, you really want to stress that. And I want to support you in that, because there are. And we just need to focus on the right things. And I don't mean to sound like an advertisement for the Biden administration right now, but they're doing the right things in the first 100 days. Climate change policy and this American Families Act that will do those wraparound services that are so desperately needed.
Trey, I'm seeing a lot of nodding along to that. What are some of the innovations you've seen in the last year in response to this that give you hope?
Well, I think, first of all, we brought a vaccine to market in record time. So as I sit here and speak to a large audience of scientists and innovators, my hat is off, right? I'm not wearing a hat, but my hat is off to you, right? In that, I think we've seen scientists, we've seen innovators, we've seen the life sciences industry, the healthcare industry, the pharmaceutical industry come together in a way that, frankly, is unprecedented, right? We've seen companies come together at one table, often with public sector partners, to figure this out and to bring vaccine to market in record time, right? That gives me a lot of hope. I think it also places us in a really interesting kind of juncture because historically it has taken an enormous amount of time to bring any sort of product, therapeutic, diagnostic, vaccine to market. Triple that time to take it to a developing country, right? And so now I think we are in a really interesting moment. And I think as communities stand up taller than ever and they demand not only more, but they demand better. We demand better, right? I think we are going to see ourselves move into a really interesting space, right? We have seen the value of science. We have seen the power of innovation from all corners of the world. Let's not forget, I love what was said there, right? Innovations don't only come from white coats and labs, they come from all corners of the world. And I think we have a really nice moment to recognize that. Listen, I think we're in a moment of reckoning. And I think as we do think about kind of the hope moving forward and how we can build off of the innovations that we have seen, there is still a lot to be done, right? While we see the power of innovation, we still see, to your point, Kelly, politics blocking access to said innovation, right? I think access is a really loaded word, right? Particularly in the science and innovation space, and for fair reasons. But I think this past year has also shown us that access is not merely about a medicine or a product. It is also about supportive environments. It is about infrastructure. It's about supportive policies. And so we have to think about that. We have to think about how we innovate in those ways, right? How are we thinking differently about our mechanisms, about our access mechanisms and frameworks, how we are valuing health, right? Differently maybe. So, you know, I think about even IP, right? And how that is hindering local production of vaccines in places like South Africa and India. If ever there was a time to rethink IP, I think now might be it, right? I see the value in IP, I do, but I do think that there is also a moment like this to really kind of reconsider that. So, you know, I think, and Kelly, to your point about, and then I'll kind of stop, but I think to your point about how private sector is engaging, I could not agree more. I think we had already seen a real shift from traditional corporate philanthropy to sustainability. And I think the spotlight has been put even more on the need for that. And I think companies are really taking that up, and I think really engaging in much more meaningful and sustainable ways across their value chain and their supply chain. I think we have to, again, rethink how our structures, our mechanisms are incentivizing their engagement, because too infrequently are they actually incentivizing private sector investment and engagement in these sorts of areas. So I think we have to rethink that. So a lot of hope, but requires some work.
So Carl, how do we rethink that? How do we this is a question that came from the audience. It feels like we've already forgotten some of the challenges associated with the West Africa Ebola outbreak. What can we do differently now to keep the focus on sustainable infrastructure for these inevitable threats that will come in the years to come?
So before I go to that, maybe 2 points on access. Unitate was created and they did something quite interesting with HIV treatment. They created a medicine patent pool, and at the time it was President Clinton that was in power, and that allowed better access to ARVs. When we're speaking about the pharmaceutical industry and what they've been able to do, we know today that the continent of Africa imports $14 billion worth of medicines that are not produced on the continent. So the conversation around science needs to also be localized. Because if we do so, the Economic Commission for Africa estimates that 16 million jobs will be created on the continent. And the implication of 16 million jobs, it means that you will have more people that are able to protect themselves in cases like this one, and maybe have a better social safety net. And that's very, very important. To the point about the lessons from the Ebola, we have to remember that these are political decisions. And if a political environment at the time when such a crisis happens is not ripe for collaboration, then you will observe what we've seen in the past year. And it's not a criticism of any institution or any individual. It's a reality that things evolve. Same way as a virus. The virus has evolved from the time it first came more than a year ago, and as it spread across the world, it has evolved. And I think by recognizing that we are dealing with something that we don't see, but the thing that we can see and manage is some of the tools that we have in our institutions, being local institutions, regional institutions, or global institutions, and how these institutions find a way to manage the politics of the time and eventually get to what is important, prevention. So when we speak about the system, the first system in any health system is prevention. Because some of us here around this table have managed to prevent ourselves from contracting the virus, either because we were able to work from home and isolate ourselves and order for delivery. But many people around the world were not able to isolate, partly because they either live in environments where they cannot isolate, or they need the foot traffic to make sure that they earn an income. So the infrastructure that we speak about when we speak about health shouldn't be a health infrastructure. It is the economic and social infrastructure that allows us to be able to navigate the politics of the time and the virus of the times that we may encounter along the way.
To turn back a little bit more towards the innovations we've seen in the last year, Trey, I think about in Texas, particularly telehealth, how the rules were relaxed to make telehealth much more accessible here in this state during this pandemic. And that seems to have provided a measure of healthcare access to some of these rural communities in Texas that have not had access and have lost access. Is that the sort of innovation that you think is going to stick and promises something we may actually come out positive from this? Or is that just a Band-Aid over, one portion of our healthcare system? Where are the innovations that you see in this last year that offer some hope?
Yeah, I think for sure that is one of them at the top of the list. I think we've seen an increase for obvious reasons, as you've stated, with telehealth, and we've seen. Even I experienced only a couple of weeks ago. My insurance provider contacted me and said, the telehealth for your therapist, right, was considered at cost, right? Like it was all fully subsidized during COVID-19, but that's now kind of come to an end as we go into 2021. You have a bill due, and I thought, oh my gosh, like, thanks for the heads up. Like I didn't even know, right? And then of course we talked to them, and it was extended again through middle of the summer. So I can tell you, I'm one who has benefited even from telehealth in a very new and interesting way. I think a couple of things. I think that you're right. It has increased access in dramatic ways. I think, and I do hope it sticks. I think that we have to think about probably normalizing it in a way. At the end of the day, as we're thinking about quote unquote last mile communities, right? With little to no access previously to health, I think we need to think about also how we are introducing new innovations like telehealth, right? In a way that is culturally relevant, in a way that resonates with them, and is in a way that is trusted. We know that most of the world is digitally connected, but we also know that we do have to think about, if we're thinking about telehealth, we have to really shore that up, right? And make sure that we are, that digital connection is a constant, right? So that we are thinking about it being expanded in areas where maybe it isn't currently. But I do hope, and I do think that telehealth is something that will start to stick, not only in the US, but in other parts of the world. But again, I think we need to also then rethink and reimagine what are those value frameworks and what are those kind of reimbursement frameworks that might be needed to make sure that access is actually achieved and sustainable.
Andrew, I'd love to hear.
Let me jump in.
About.
Can I? Yeah,
I
want to jump in on that one. So I don't think telehealth is an innovation. Telehealth is something we knew how to do before the pandemic, and we just didn't do it. Mm-hmm. We lacked the will to do it. And what did we do in March when we couldn't be paid for our in-person visits? We immediately totally universally, is in every case possible, went within weeks to telehealth. And not only does it improve access, it also improves use of scarce provider. We don't have enough providers of anything in the United States. Productivity rates increased by 33% to 100% because people don't no show. They don't run into traffic. They don't have childcare fall through, or they do, but the kid sits on their lap. I mean, they still make their telehealth appointments. So it's a dramatic game changer, particularly for mental health, where research shows it actually works better. The other thing we need to keep in mind is broadband is important, digital world's important, yay, digital world, but most people have these around the world, and audio only works fine. In fact, we were joking about this before we started today. Most of us who've done Zoom all year now know how much we prefer the audio only call. We would love to be talking to people without having to, get all pretty and look at our faces. So audio, and this is more about psychology and psychiatry. And I think that's the thing I want to keep in mind. There is a rocket science component to this that Trey, I think, said really well, about, my gosh, the fact that we have vaccines, but the prevention that worked before we had the vaccine is more what Carl was talking about, was public health. And my family they grow apples, right? They had to keep food production going the entire pandemic. And, the big thing they had to get were thermometers. They had to get, fine masks. They weren't prioritized because they're food workers. They're not frontline healthcare workers. So public health, simple things that we just need the will to do is another part of this. So we need some grand plans and some big things too. I'm not against that, but there are simple things that we simply need the will to do.
Yeah. Yeah. It's so funny because, again, we talk about these things and they seem simple. Why didn't we do this already? It gets to be sort of frustrating when you think about it. Kelly, where are your worry points out of this, though? We see these simple, identifiable little bits of the problems we could chew off, but what worries you that we aren't going to address, that we are going to let just relapse to a pre-pandemic state?
Well, I think it's so easy to forget the climate change impacts of what we do when we're panicked and we're stressed. And great example is here in New York, I have a friend who's an event planner, and he's such a great event planner. And we've been best friends since we were 17, but I also use him because when he does an event for me, he will tell me exactly where the locally sourced food is. He will use no plastic. He will use this. It's been driving him nuts because now suddenly events, everything has to be single-use plastic wrapped in more plastic. And so they let the pandemic and their fear of germs make them forget about the planet. And that's why I started off by saying this was a dress rehearsal. We are not ready for the performance of climate change. It's like someone just told you that you're going to perform Hamlet tomorrow. We are not ready. So I think every single thing we do has to be asked, but what are the impacts on the planet for this? Yes, we need to do this, but what are the impacts on climate change? Everything there. And then the same thing with equity. An equity lens has to be applied to everything right now. And that's why I love everything that my co-panelists have said here. It's clear that they're not thinking of anything without putting an equity lens on it. And that's so, so important. So those are the only two things I think that everybody needs to think about going forward. And if we don't, I'm worried, but I'd like to be positive. That's what we all should think about going forward. And then lastly, and I think you said this, Trey, but forgive me if someone else had said it, that we need to partner, that we need to come together. I'm launching an adult job workforce program later this year with one of the biggest hunger organizations in the country. And they came to us and they said, we know we're going to have to keep feeding people. And they did this before COVID. We know we're going to have to keep feeding people, but we'd like to keep people out of the food line and back to work. And it was so great. And we said, well, thank you for even thinking of us out of all the many, many companies that support you. And I was so moved because a big tech company just reached out to me on LinkedIn and said, I'd like to support what you guys are doing in employability. So too often we do everything because we want credit. I want HSBC's logo on it, so I don't want to. No, anyone who wants to join with us, or I'll join with other, if I hear about a program that's great and another bank is doing it, I will be the first to reach out to them and say, how can we support you? So we all need to partner together too. So those would be my three things. How does it impact climate change? Am I looking at this through an equity lens? And then am I making sure I'm partnering with others? Are there others that are doing this? Are there scientists that have the expertise? Are there companies that have the resources? Don't try to do things alone if you can do it better together.
Carl, where do you think we have a fear of relapse, where we're very quickly going to forget the lessons we learned over the last year?
It's looking at the informal sector of the popular economy on the continent, and very quickly sort of accept that this is the routine again, that when it's 90, sometimes 95% of economies on the continent, it's actually your economy, because this is what drives it. And if we don't pay attention to the fact that measures like physical distancing and lockdowns affects this group of our society disproportionately because of the need for foot traffic, then we may have missed an opportunity to really rethink the model that we need on the continent. But I am hopeful, because digital tools were found, and not using USSD, meaning that you don't need a data connection. You can use short codes to be able to have access. And that's how, for example, in Togo, people were able to register and receive money on their cell phones. So the digital element is extremely important. One thing that is also makes me hopeful, and I think we've learned from it, is a question around resource allocation, because the US has taken the lead on talking about taxation. And how do we ensure that we find a way to have more resources for some of the investment that are required? And because you have then the cue from the US about this conversation around taxation, you may see that in other parts of the world, there's also that conversation. And it has to be contextual. We know that in terms of tax to GDP ratio, we have room to improve on the continent. Therefore, there are more resources that we could be able to generate. And the last thing for me is that from the 1st of January 2021, the continent has entered into the African Continental Free Trade Area. So we then have this sort of Pan-African goal of having these 54 fragmented markets to become one. And when you have these kind of goals, you are forced to think about the mechanism that will allow the 1.2 billion people to actually transact. And one of them they have to be healthy. They have to get a job, because if they're not healthier and they don't have the resources to spend on what you're going to produce, they need to be a challenge.
Trey, what are the lessons you worry we might forget?
Yeah, I think a couple of things that give me, I guess, pause or concern. I think first, maybe not a lesson, but it's something that concerns me is, as we focus so much, and rightfully so, on COVID-19, we have also seen so many vital services disrupted or paused. We've seen, traditional mistrust of systems for various appropriate reasons really continue to perpetuate this mistrust in our systems, and that influences then seeking behavior of care, et cetera. And so I do worry that as we start to inch toward a world that is post-COVID-19, that we are doing so in a way that continues to adapt and accelerate our programming in those areas that might have been put on pause. I think particularly around services for women and girls and their sexual reproductive health and rights. I think so much of that has really been kind of paused for a number of reasons. I think also as we think about the access issue, particularly for Black, Indigenous, and people of color, BIPOC, it's interesting. We started off the conversation by saying these are not new issues, and I think that can't be underscored anymore. As someone rooted in public health, we have been beating the drum on these issues for decades, including for a pandemic, by the way. And here we are, right? And I think, at least in New York City, if you take that one city and you look at New York City, and if you were to put a heat map over the city and you would compare, let's say, heart disease or diabetes and COVID-19, we would not be surprised that they are very similar maps, right? Disproportionately impacting Black and Latinx communities. And so I worry that when we think about, yes, we are all talking about equity and how equity has to underpin everything we do, I am worried that we will miss that point, that we will miss the plot of the story, and that we will all go back to where we were. I think, part of that has to do with our systems. And again, we have to rethink about how we are reimagining them. So that we are decolonizing them and placing those communities right at the front and center. And I think the last thing that I would say is nationalism. Someone else, I think, Carl, you said it before, we have reverted, right? We continue to close our doors rather than extend our arms. We've seen some great examples of extending arms, right? Great examples of solidarity. But on a whole, from a political perspective, I think we have experienced, and I hope we're coming out a little bit of that moment, but we have experienced heightened nationalism and kind of caring for ourselves, right? And our systems continue to, I think, value purchasing power when we think about our stockpiles of vaccine, our access to care, our health systems, and we've got to rethink that.
So I guess I want to shift now into, how do we not lose the plot here? How do we not, how do we make sure that some of what is all becoming top of mind over the last year remains top of mind and actually spurs action? What will be different this time, since we already knew these things existed and hadn't addressed them? How can we truly build back all of what we've lost this last year, but in a better way, in a way that addresses issues of inequity, in a way that addresses issues of poverty, of lack of opportunity? Andrew, I'd love you to start that discussion off.
Yeah, well, I'll start just in kind of my area. I mean, I think that we need to do the things that we know work. And let me just tell you a micro one and a macro one. A micro one, one thing we all learned this year is mental health is real and it's part of all of our lives. It touches all of us. Addiction's real. I mean, when they started doing home delivery of alcohol here in Texas, I need to think through this more. So it's something that we're all struggling with. And we just need to lean into that. And if someone says to you, hey, I'm thinking about taking my life, talking about suicide, talk to them. Don't think you're going to make that worse. You won't make that worse. You will make it worse if you don't talk to them. That's one of the main triggers for people to make a decision to follow through on suicidal thoughts, is to reach out for help and to not be received, to be sort of rebuffed. And we worry, we're going to say something to make it worse. You can't make it worse. What makes it worse is being alone. And that's true for every condition, not just addiction, not just mental health. So lean in, be there with each other, and be more permeable. I think that's one reason, frankly, that I am optimistic about us addressing some of these equity issues. I think when we watched what happened in multiple cases last summer to Black men encountering in America law enforcement and meeting tragic ends, that's not new. That had been going on, but we saw it, I think, in a new way. I think many of us were more emotionally permeable to that, and we had a lot more allies in that. I think at a macro level, there's also things we know how to do. A lot of what we did for COVID-19 early on were things that we knew from other epidemics. We knew about masks. We had a little debate about it, and some people still debate it. We knew about masks. We knew about social distancing. So we dusted off these things that we hadn't done, and we started doing them. The good thing, and I'll just talk about my field of addiction and mental illness, while we're at unprecedented highs from death of suicide and overdose, if we just took two things we know how to do. One is to embed mental health care in primary care, just like you have a nurse. Second one is to use medications that work, like buprenorphine, to eliminate addictions to opioids, as well as now evidence that it works for methamphetamine. If we just did those two things, we could save 1/3 of the lives lost to suicide and overdose every year. Universal access to those two things. So let's do the things we know work now, and let's use some of that will. Let's harness that will that we used when we were scared by the pandemic, and do some other things that we should be scared and care about, and we can do them. I mean, that's, to me, we can do this. We did it. And I mean, we haven't totally done it, but we've done a lot, and we can do these other things.
Kelly, what are your thoughts about building back better?
Well, I loved everything Andy said. And it's funny, I remember when you were talking, Andy, about a TED Talk I watched a couple months ago about stress and the impacts of stress on mental stress on your physical health. And it basically, the theory at the end was the best way to alleviate that is to help someone else. So what I hope is that we don't go back to our bars and restaurants and shopping malls and forget what we achieved this year and forget that we are better when we help someone else. That's the planet. That's people who are in different circumstances than we are. This year showed us that we're all interconnected. So you can't go back and say, shrink back into your little world and say, well, I'm going to have my sweet 16 parties and my elaborate, whatever events and corporations where we create this giant set and we throw it in a dumpster afterwards, whatever your version of kind of putting your head back in the normal sand that you used to be in. Don't get back there. Don't be complacent again. Remember what we went through this year and remember what we achieved. We all immediately started working from home. I'm sitting in a closet right now. This was my closet. Those are my clothes behind me. And I've worked here for a year and I've done it somewhat effectively. I guess if my boss called in, he might say not so much, but we're all doing our jobs in a totally different way and we're still doing them. So don't forget what we achieved and don't forget how important it is that we all work together to save us from something far worse in the future. We can do it. We can do so much. And the most moving things for me is how quickly we all worked from home, wore masks, washed our hands. We all learned to sing happy birthday twice and wash our hands. But also remember, we all let that go when George Floyd was murdered. We all said, forget it. I'm going to get to the streets because I care so much about other people. It's going to override this deep fear I have for my own safety and health right now. That's amazing. Let's not squander that. What an incredible thing that we've done in the past year.
Carl, how do we build back better?
As I say, I prefer your formula, building forward in a better way. Solidarity, one word, solidarity. If it's one thing that we've has been emphasized during this past year, it's how strangers have found a way to help another stranger. And this is what we need, more of that. And I mean, Andy has reminded us throughout this conversation of the issue around mental health. And that mental health is not necessarily the person who's walking naked in the street, that we've all been affected. When families have to live in 65 square meters for a year, and or when an individual has to live alone in 30 square meters, and that ability to have a social interaction is completely gone because they have to preserve their life, those are issues that we need to remember. So pick up a phone and calling somebody that we know is alone, wherever they are, is important. The rest will follow because I think we understand that another pandemic like this one, where we are not prepared, and being prepared doesn't necessarily mean that we all have to be vaccinated. It means that we have to understand prevention. And I think that is key. Prevention in terms of mental health, prevention in terms of disease that we may be exposed to. And of course, if we all get vaccinated, even better. But until we get there, especially for me sitting on the African continent, until we get there, I have to make sure that I prevent myself from being affected. And that can only happen by also solidarity. When I see something that I can help somebody with a mask, I have to do it. So solidarity.
Trey, what are your thoughts on how we don't lose the plot here?
Yeah, so I think two things. I think first, for me, I think we have seen more than ever that public health crises require public health responses. And I think for too long, we, in many areas of the world, the US included, have invested in medical systems, not health systems. And I think we've got to get back to the basics here, and that really speaks to the prevention message that others on the panel are hitting home. We've got to rethink our approaches to public health, and we've got to think about it in a way that is really comprehensive. It looks and moves beyond health, beyond medicine. And addresses social determinants of health, of care, right? So that we do not continue to find ourselves in this space where your zip code continues to perpetuate poor health. We've got to move past that. We can no longer continue to live in that world. It's a world I refuse to continue to live in. And so I hope that we all continue to stand up and demand not only more, but demand better. And the other thing that I would say is, I spent a lot of time more personally this past year really thinking about the idea of space right? Space has changed for all of us, right? Our closets have become our conference rooms. Our living rooms have become our yoga studios, and so on and so forth. And I think, you know, against the backdrop of what was happening last year with the murder of Breonna Taylor and George Floyd, and what was happening with the rise of the Black Lives Matter movement, you know, I just kept thinking to myself, space means something very specific to me, but my God, what does space mean to people who already lack it and are being pushed further to the margins? And so I think as we move forward, I would say make space. We've learned this year that we have to make space physically, but Kelly, as you said, we also were reminded very quickly to make space with and for each other in the streets, right? As we commune and rise up. And so I think as we move forward and think about our approaches, our systems, our policies, our financing, we have to make space for the communities who are going to benefit at the end of the day, right? Which really at the end of the day will be all of us, because why? Health is wealth.
We just have a few minutes left here. So where I would want to sort of leave our discussion is, you know, we talk about these big global interconnected systemic problems, and I'm just one person. What can I do about it? How can I contribute this? I'd love for each of you to just share just one quick concrete step that you or your organization is taking to help this recovery. And Andrew, let's start with you.
So I would like us all to pretend like mental health is the same as health. Like, just pretend like it's actually their physical health needs that you can meet. And so they're not mysterious. They don't require anything different than you being helpful, helping someone get to a doctor, or better yet, doing some of the prevention that we know works to help prevent that. Just pretend like your brain is in your body. That would be what I would like you to do.
Great. Kelly?
I love that. And I'll add to that and say, remember that your health is also the planet we're on. Absolutely. The health. And I loved what Trey said too, that it's not your health, it's the collective health, the health of your neighbor, the health of the person who's struggling down the road.
Great. Carl, what's a concrete step that we can take?
Buy local, support SME.
And Trey?
Demand better.
Demand better. Demand better. All right.
I think we'll only get better if we rise up and demand it together, right? Demand better.
Fantastic. Well, this has been a fantastic discussion. I think what I'm going to take away here is, I think Carl summed it up, solidarity. That what this pandemic has showed us and exposed to us and revealed to us and underlined for us is just how interconnected we are and interdependent we are on our fellow human beings on a global scale, on a national scale, a state scale, even on a community scale. You go to your grocery store and the air you're breathing is affected by the air being breathed out by everyone in that store. And it's something that none of us thought about, but now you can't help but think of it when you step into a store. So we are all interdependent there. And at the same time, that should give us hope, because together, if we can come together as we have to take these quick steps to change our society, to work from home very quickly, then we can do it for these other challenges. I hope. So I share in that hope with all of you. So again, thank you all for being on the panel. Thank those of you in attendance.